Hi, I'm Dr. James Stockton. I'm an adult psychiatrist at Prevea Health. Patients generally come to see me when life is not working in one of many ways. Sometimes this is in the realm of depression, where we're finding we spend too much time in our head, or where we spend so much time worrying that we can't get much out of life. On the whole, our goal is to expand a patient's life and help them make a life that's more fulfilling for themselves, and that's always going to involve work. It's always going to involve effort. In the realm of mental health, there's no easy, simple explanation as to why things are happening. We can't really point a finger at our brain or point a finger at something and say that that's the reason why we're going through what we're going through. These problems tend to be an awful lot more complex. My ultimate goal is for patients to have a fulfilling life that they feel good about. And that's always the long-term goal. And the way that we get there is different depending on the patient, but at the end, that's the end goal. Where am I? Where would I like to be? And what can I do to move myself in that direction to have a life that I'm more happy with?